Well, good afternoon, everyone. Welcome to Trust for America's Health, Age-Friendly Public Health Systems, or AFPHS, March training. Oh, sorry, this isn't March, this is May for our training series. We're really happy that you're here, that you've joined us today to learn more about how the public health sector can support older adult health and well-being. My name is Megan Wolf. I'm joined today by my colleague, Dr. Karan Phillips. The AFPHS movement would not be possible without the generous support from and partnership with the John A. Hartford Foundation. Next slide, please. So as I mentioned, we would appreciate it if you could keep your devices muted during the presentations. Feel free to put your questions in the chat function throughout our presentation today, but we will have opportunities to have some discussion throughout. Next slide, please. So as most of you know, TIFA is a public health policy research and advocacy organization dedicated to optimal health for every person and individual. TIFA produces several reports annually, including our Ready or Not report, which focuses on emergency preparedness and Pain in the Nation on the epidemics of alcohol, drug, and suicide deaths. Related to healthy aging, we've published reports and briefs on several topics, including housing and rural healthy aging, and you can find those on our AFPHS website at afphs.org. Next slide, please. So this year, our trainings are focused on exploring public health roles in addressing equity, which is foundational to the AFPHS framework and to TIFA's work in general. We have focused on ageism and how we can communicate better about aging in America. We've talked about data, and last month we featured TIFA's Ready or Not report and the importance of including older adults in emergency planning, particularly around climate emergencies. This month is recognized as Older Americans Month and is set aside as a time to recognize older Americans' contributions, highlight aging trends, and reaffirm commitments to serving older adults in our communities. This year's theme is Powered by Connection, intending to emphasize the importance of meaningful relationships and social engagement and how important they are to our health and well-being. So our training today is focused on social connections for communities. Before I introduce our speakers, I did want to also just share that we will have some discussion on what social connection looks like to you. So as our presenters are sharing their information with us today, please be thinking about that question and what is social connection? What does that look like in your community? Next slide, please. Our speakers today are Phil Bors, who's the Senior Project Director at Healthy Places by Design. And if you're not familiar, go to healthyplacesbydesign.org. They have a great website and lots of wonderful resources. And we're also joined here today by a new partner, Morgan Marler, Innovation and Implementation Program Manager at the Foundation for Social Connection. And I am thrilled to learn more from both of you and to hear more about the Foundation, because that's a new organization for us to partner with. So I'm really happy to have you both. Welcome. Thank you so much for being here. And I will turn the program over to you.
Thank you. Megan, it's a pleasure to be with you today, and Karan. We're so excited to see everyone and to be talking about this topic. If you go to the next slide, please. So here's how we're going to spend our next hour. In a minute, we'll say a few words about who we are. If you would, please put your name and organization and maybe even location into the chat box. And then many or most of you already know a lot about social isolation as a public health concern, but we'll start by sharing some data about the national picture, and we'll go through some promising strategies too. We're excited about a few community efforts to highlight. There are way too many to talk about in terms of bright spots than we have time for today. So know that there are many examples out there across the country. Morgan's going to share a very useful planning resource that came out late last year for community leaders to take action on social connection, and will suggest a little bit of additional reading. And of course, like Megan said, we'd love to hear from you about what's going on where you live and work. Next slide. Morgan, thanks for joining me today. Would you say a word about yourself and the Foundation briefly?
Yeah, thank you so much, Phil. It's so good to be with you all. I saw someone is in the DC area, which is actually where I'm calling in from. I'm Morgan Merler. I serve as the program manager for implementation and innovation at the Foundation for Social Connection. We were founded in 2020 prior to the pandemic, and really are focused on advancing social connection, addressing social isolation and loneliness, and doing that through a really research to practice frame. We have a scientific advisory council who informs all of our work. And we are really excited to be a part of this conversation today. And before you all joined, Megan and I were just talking about how much we're seeing all of this in the news and just the impact that we see of this issue across the lifespan, especially our older adults. And I'm just really grateful for the work that you all do at the different health departments you represent and organizations you're at.
Thanks, Morgan. Greetings from Durham, North Carolina, where I work. Healthy Places by Design is a national nonprofit. We work sometimes at the community level with leaders. Sometimes we work more at a national level with funders. In general, we partner with health-focused funders to support leaders and coalitions. We also work directly with local groups and states on primarily place-based strategies that advance equity, health, and most recently, social connectedness. So really, so glad to be with you today on this topic. Next slide. So we're going to ask you in the chat without hitting enter, so hold on a minute. What is a place in your community where it's easy to connect with others? And we're going to do what we call a chat fall, where everyone can enter in when I count to three. So where's somewhere, a physical place where maybe you go or you notice that others are gathering to connect with each other, and maybe they know each other, maybe they don't, maybe it's an opportunity to meet new people. So I'll give you about another 30 seconds and we can start seeing what's learn more about those places. Oh, they're already coming in. Okay, go ahead. 1, 2, 3, enter in those places. Grocery store, library, 2 senior centers, and 1 is a community center also. Donna, thank you. Saturday morning flea market, Megan, yes. A neighborhood diner, yeah. So much a connection happens around food. Chandra, coffee shop, congregate meal sites, rec center, library again. More coffee shops, church, ball games. Great, thank you, Beverly in Florida. Schools, yeah, and festivals. You know, it's easy to think about festivals and parks as good spaces. Golf courses, Cynthia, thank you. And commit the faith-based organizations. These are all great places for connection. The gym, yeah, this is a good one, and it's mixed, right? Right, Emma? You know, so you see people all together, but they have their earbuds on, and I'm guilty of that too. Every once in a while, you know, you can make a connection with people. Nonprofit volunteering opportunities, right? You know, it's something that a theme that we hear for those that have engage a lot of volunteers is they in the organizations they may see volunteers as like an extension of the team of the nonprofit, but what's also happening is the volunteers through their work are taking advantage of social connection opportunities themselves as they do the work. Extended education courses. This is really great. Thank you for this. Every time we ask, something new comes up. We typically see, you know, the importance of what we're going to talk about in a minute is social infrastructure. These are the things in communities that, you know, that are generally publicly supported, like parks and libraries, and they're critical public open spaces and streets. They're critical infrastructure. You think of them as infrastructure for some utility or some other purpose in the sector, but they're also potentially places when done right, when designed right, for social connection. Dog parks, right? Good for connection of animals as well. Thank you so much for telling us where people connect in your community. Maybe we could go to the next slide, Megan.
All right, so I'm going to share just some kind of high-level data just to ground us all in the current state. I'm sure many of you are familiar with the slides and data that I am going to present, but just think it's important to kind of ground us all in the current data. Can I have the next slide, please? So I don't think that this is unfamiliar information, but unfortunately, we're facing a global crisis of disconnection. Millions of Americans are socially isolated, lonely, or both. It's really important to understand the definition of both isolation and loneliness. So loneliness is the subjective measure. It's the gap between the connections that we want to be having and that we need and that we actually are having. Where isolation is actually the objective measure. So if you think about a homebound adult, or a child who is in the foster care system, they might be isolated from the connection or the family, or whoever is the person that they're connecting with. So it's just really important to kind of differentiate those two. But it can also be the case where someone's experiencing both of those. And what we know from research is that it has a really negative impact on the quality of life and then the health outcomes of an individual. And this is seen across the globe. If you're familiar with Nina Goldman, she's doing a study of 52 different countries across the world, looking at the state of social isolation, loneliness, and connection. And she'll be actually looking now at 5 countries that have policies or practices within their kind of national kind of policy agenda that are focused on these issues. So post-pandemic, we have seen that more than 1 in 2 adults in the US are experiencing or reporting loneliness. Which is consistent actually with pre-pandemic rates. So this is also something that, people are really seeing now that we've all experienced loneliness and isolation, but that it was in existence previously. The other thing, while we're kind of focused on older adults in this conversation today, the other thing to note is that young people are also experiencing loneliness and isolation. 23% of young adults aged 18 to 29 say they don't actually know a single one of their neighbors, which is a pretty crazy statistic. The other thing that we've seen is that with this decrease in connection, we're also seeing a decrease in trust. So in the 1970s, 50% of Americans felt that most people could be trusted. And in 2012, that figure has actually declined to almost a third. So from 50% to 30%. It's a big decline. Can I have the next slide, please? So these graphs might be familiar to you. Dr. Robert Putnam wrote in the early 90s a book called Bowling Alone. And that book was really seminal in looking at the decline of our ways of connecting with one another, and also just societal engagement. So you'll see here that as social isolation goes up, our time spent in all of these different ways in companionship with family members, with non-household family members, with friends, they're all declining. And this is, you put different trends next to each other and they're almost parallel, if not right on top of one another. Next slide, please. Bill, is this your slide or my slide?
Sorry, that's me. I've been using Zoom for 3 years and still having trouble with the mute button. So Morgan gave us a glimpse of some of the data that we have about social isolation. We knew people were isolated. We have known that for decades, and but we're just starting to get it as a public health community. So it's been so helpful to have the Surgeon General Vivek Murthy champion how important social isolation is, and the other side of the coin, how important social connection as a public health response can be. So last year, many of you know this, his office released the first report of its kind to bring this data all together and really focus on the community as a whole rather than individual patients or clients or people within a particular facility. The message is pretty simple. You know, we're wired to be social, but we've become more isolated in many ways, as Morgan has just said. There's a clear health connection too, and there are things we can do about it. You know, we can actually look to examples where communities are creating greater connection. Next slide. So this is also in the report, and we have a link to it in a later slide. It's not a detailed blueprint, but what I like about the advisory is it lifts up 6 important strategies. It gives us a general direction, and you can see these displayed on the right side of the slide. So enacting pro-social public policies and mobilizing the health sector around social connection. And Megan mentioned this at the top when she talked about the community health needs assessment and the health improvement plans. That's an example of how the health sector can come around it. Incorporating that right into what public health does. Improving digital environments, deepening our understanding about isolation and connection. This refers in many ways to the research that we need to continue to do. Building a culture of connection in communities. And while it's number 1, I finish with it here because I have a few words about strengthening social infrastructure. So this is an area we're very interested in at Healthy Places by Design. I mentioned that place-based strategies are part of our work for sure. Social infrastructure is like the community-built environment that helps facilitate people connecting in public. And we saw that all in the chat when we did the icebreaker. So it's the open spaces, it's parks and streets and community buildings and libraries and other public places that support cohesion and connection. Next slide. So we have a few examples. As I mentioned, there are more that we know of than we could ever share with you today, but we're going to just highlight a few and then hear from you about what's happening in your communities. Next. So these 2 photos show how public places in the city of Boston create connections, opportunities for the connection and across generations. So even modest or what we refer to as pop-up projects, so things that may be temporary or they're relatively inexpensive and can test the popularity of different improvements in the built environment. On the right is an example from Dorchester of how a local artist worked with young people and other residents to bring to life this street furniture. So you can see it, maybe you can see it in the picture, the colorful bench that the woman, that's actually the artist who's standing on it. So a long bench covering like a utility pipe that stretches along a bridge that's right there adjacent to a transit station. You can see the tracks there. So at that same station, the organizers worked with the transit agency to beautify a drab parking lot and use it on weekends for pop-up community events. So if you're wondering about the term social infrastructure, you know, that pipe that's going by without anything on it that you could sit on or a person could use in the community, that's infrastructure. Social infrastructure is maybe a slight design twist that enables it to be a place for gathering and connection. On the left, that picture is from Chinatown, which is Boston's neighborhood experiencing the greatest heat stress. And this is mainly due to very limited green space. So what you see there is a grand opening of a play and gathering structure called Dancing Dragon. It's on a teeny parcel of land that's next to a residential building that's managed by Asian Community Development Corporation. This structure was co-created with residents and community partners. This was one of many activations that bring together older adults, families, and young people to share their stories with each other. Both of these projects, I'm happy to say I was involved in. They were part of a project funded by John Hancock, so Activating Boston. It was a pilot initiative that were so successful that we're now starting a second round of grants to co-create new projects and improve and activate public spaces that bring people together across generations. Next. There are other ways that public health practitioners and their partners have started to already incorporate social connection into their work. So in Brown County, Wisconsin, the health department worked closely with other partners, other organizations to prioritize social cohesion as one of their top 3 priorities in their community health improvement plan after collecting data on social isolation in their health needs assessment. This slide has a lot going on and it's a little small, so I apologize, but we can definitely get you the slides, and the details aren't too hard to find if you want to Google this. But social cohesion stands out, and it's within this priority of building community connections at the neighborhood level. So in the small print, it's on the left. Their metrics are when they're collecting data and surveillance over time, people seeing themselves as a member of the community, people rating living together as neighbors, and their satisfaction with personal relationships. So also interestingly, you may not be able to read it, but their other 2 cohesion strategies focus on increasing healthy food availability and walkability and recreation. So this is because of the important overlap between food, activity, and social connection. Next. At the state level, I'm so happy to highlight a group in Massachusetts who have been at this for quite a few years. It's the Coalition to Build Community and End Loneliness, which is supported by and helped started by the Massachusetts AARP. And it's made up of dozens of state and local organizations. They started as a task force and just very recently transitioned their name to a coalition because they know that their work is ongoing. They've done a lot to highlight social isolation as a real critical public concern in Massachusetts. And some of the things they're working on, they produce their own TV discussion series and interview series. They hold an annual Good Neighbor Summit on social connectedness. Their site has a nice clearinghouse of reports and resources and a number of other partnerships and projects. One of those is a program they had a couple years ago called Chat Benches program to promote community conversations in public spaces. So I encourage you to see their website, and I'll put it in the chat just so you can see that. And if you go to the next slide, Morgan, would you say a word about Samaritan as a local partnership?
Yeah, absolutely. Thank you, Phil. Donna and I were going back and forth in the chat. She's also in New Jersey. And so Samaritan is a nonprofit hospice care provider in South Jersey, located in Mount Laurel, New Jersey. And they have really found that among folks that they work with and also just in the community that they serve, rates of social isolation and loneliness were really high. And so they actually took it upon themselves to be an organizing body to help form a coalition in South Jersey focused on advancing social connection. What you see on the screen here is actually some photos and a picture of a mural that was created from a day-long workshop that I helped facilitate, where Samaritan brought a really diverse group of stakeholders together, including folks from the Boys and Girls Club, interfaith leaders. We had people from Health and Human Services, different organizations across South Jersey. We brought them all together to talk about social isolation and loneliness. And now they're actually amidst forming a steering committee and are going to be working through the action guide, which is the product that Phil mentioned that we put out at the end of last year, and that I'll be going into in a little bit. But just really excited to see an organization that's working with older adults at the end of their life, thinking about how do we actually increase social connection across the lifespan, and how do we do that in a really diverse cross-sector coalition.
Thank you, Morgan. I think we're doing well on time. We'd love to hear from you. So we've in a very short period of time thrown a few examples at you. So the those projects that are focused on social infrastructure, projects that may be incorporated into say a community health needs assessment of public health. We've talked about partnerships, coalitions at different levels. Would love to bring your voices in here. I'm not sure if you can use the raise hand feature or maybe just unmute. Don't be shy. If you have what are some examples of initiatives or projects that create more socially connected communities where you live or work? Go ahead and let us know what you're seeing, maybe what you're part of, or what could happen. And if feel free to put things in the chat if you'd rather. We'd love to hear your voice, though.
It looks like Donna has raised her hand. Donna,
hey,
go ahead.
Donna, thank you, Megan. Donna, what comes to mind for you? Make sure you unmute. Donna, your hand is up. If you're speaking, you're muted. We'll come back to you. Beverly, it looks like your hand is up. Would you say hello? And do you have an example in mind?
Sure. Hi, everyone. I'm Beverly from the Department of Health in Suwannee and Lafayette counties in Florida. So we are a very rural county. Lafayette is the least populated county in the state of Florida, which we cover. So Monday we'll be delivering a blood pressure kiosk at the senior center. They service, I believe it's around 30 elders in our community. So we're very excited for this, but hopefully it's going to bring more seniors into the center where they can connect with others, but they'll be able to come in, have a seat at the blood pressure kiosk, and it will print out their blood pressure for them. So we're just hoping that, because now the center is not used a lot, there aren't many people that come to the center. So we're hoping that this will let more seniors know what's available. And we're just really excited to be able to provide this for our county.
That's a nice example. I've heard people refer to social connection strategies as a multi-solver. And I think what you're describing is an example of that. So you're providing an important health service through, the hypertension screening. You're also creating that, at least for that short period of time, that senior center as a destination, a reason to come and be connected to others. So thank you for that example. Donna, I see you're unmuted. You want to try again?
Yes, actually, it was because I had to accept that you're recording this. So it wasn't letting me unmute until I accepted that. No, what I want to say is one of the things that we just formed in my community in Central New Jersey is we formed a stigma-free council. And of that, I'm chairing the older adult subcommittee. And so we just met last night. And one of the things that we're planning is an intergenerational program where they're actually going to have the youth groups are going to be putting on a program like in September. And so we're trying now, one of the ideas that we have that we're trying to work on for the next couple of months is to make it an intergenerational art program where we work with the senior centers. We have 2 senior centers in town, one a county sponsored one, and then one a township funded one. And then we also have a youth group that's based out of our township, that's funded through our township, as well as we just built a giant youth center about a year or 2 ago. So we have all the pieces, and now we're trying to connect them in a positive way and trying to cross that bridge, make that bridge come together between the generations so that there's more understanding and more compassion between them.
That's great. Donna, say a word about the youth group in particular. If folks hearing you are inspired to do something across generations, they're familiar with the senior services sector more so, and maybe less around youth. How might they move forward based on your example?
Sure. So I wear multiple hats in my town and in my county. So one of the things too that I'm involved with is the Municipal Alliance, which is a drug prevention group that's funded through the state, through Jakarta. And so that actually runs out of our recreation department, which which is where the youth center is based. So when we have our monthly meetings, we actually meet at the youth center. So I know like the key players in the recreation department who focus on youth. And so that's a great avenue, as well as the township that conducted the local needs assessment. We just had a year or two long needs assessment that was given. We got a technical grant from Sustainable New Jersey, I think it's called. Well, I wasn't involved in that part. I found out about it after it had taken place, and after it had been granted, and I was part of one of the focus groups. And so, a lot of things were identified in terms of needs, but at least 3 out of the 10 key takeaways pertain to older adults. So one of them was the need for more specialized social and emotional services that are needed. So that ties back to your discussion on social isolation. Even though we're somewhat of an urban town, I mean, we're rural, but we're right next to New Brunswick. We're 2 minutes from New Brunswick. We're half an hour from Princeton. So we're ideally located, but there's still that isolation that can exist as well. So
Great.
as far as the youth group, we also have a township sponsored youth leadership group, which runs through our township recreation department as well. And so we have, like I said, the township senior center, and the recreation department would be the cross connection between the youth and the seniors.
Great. Thank you for the details. Donna, if someone wanted to follow up, I wondered if you wouldn't mind putting your email in the chat
Sure.
if people were interested in learning more about your work. And if there's an easy link to your, a web page or something, they might want to follow up on that. And Beverly, if you don't mind as well, just dropping your email in the chat in case someone's interested in replicating your screening program. So I noticed, Luz, thank you. You mentioned opening a senior center around the most needed town in Boston. We started with 10 and now we have over 400. Excellent. We have a couple more minutes. Would anyone else like to unmute, raise hand, or just unmute and join the conversation? Okay, well, we have, I think we're ready to transition. Sorry, Karan, we're gonna revisit our slides, our next slide down on the community planning tool and resource. And thank you, Donna and Beverly, for putting your emails in. So we encourage you to follow up with either of those if you'd like to know more information. Donna, thank you for putting the township homepage in. Great. So next slide, please. Okay. So Morgan, would you lead us in a conversation around the action guide?
Yeah, absolutely. Can we have the next slide, please? So you'll notice that as we shared our slides with Megan and her team and Karan, something happened with the fonts, and they are now off the screen. So I'll do my best, and we will follow up with our deck so that you all can take another look at it. But we'll give it the PDF so it doesn't go from Mac to PC. So the action guide for building socially connected communities was launched in partnership with between the Foundation for Social Connection, Healthy Places by Design, Harvard's Human Flourishing Program, and funded by the Einhorn Collaborative out of New York City. Next slide, please. So the action guide, I'll get into the what, but I really want to focus on the why and the how first. So as we have engaged in this work, so much of the interventions that are occurring are happening at the individual level. And while that's really important, the drivers of social disconnection, isolation, and loneliness are really systemic and cultural and community kind of driven. And so in order to really impact the most change, we believe that you have to keep it focusing on the individual, but you also need to go up to that next level to really think about how do we make a difference and advance social connection. What we have seen as we've talked to leaders across the country is that as they identify that this is an issue area they really want to focus on, there's not a very clear way of how to do it, of how to approach it, and even to choose where they focus their energy first. We've talked about how this is an issue across the lifespan. We heard from Donna and Beverly about work that they're already doing. How does that impact their communities? So we focused our work in producing the action guide on how do we equip local leaders with the tools and resources and a really friendly framework to start looking at how do they advance social connection and move from kind of the data into the how. Next slide, please. So these are just the beliefs that we held as we engaged in the design process. So we really believe that community members and leaders are the experts in their own community, and therefore the tools that we created needed to be to meet people where they were and really put them in the driver's seat of the design. We also believe that an equity approach is critical for healthy social connection, and especially inclusion, and thinking about what that actually means, making sure that everyone who's impacted is at the table. You'll see that in the action guide that's reflected, and that to enact really meaningful change, it's really only possible through collaboration, systems and strategies, and inclusion of community members' perspectives. And Megan talked at the beginning of just what does it mean to working across sectors, and we've seen that the most impactful initiatives involve sometimes the strangest partnerships, but they really make the biggest difference. Next slide. So this is also a slide that has very small print on it, but I promise you will get a copy and you can take a look. But this is just to give you an idea of the timeline of development of the action guide. So you can see that it really started in November of 2022, where we did a pretty significant literature review, looking across frameworks and tools, really making sure that we were not reinventing the wheel. And then in March and April of 2023, we actually did 4 listening sessions in Bangor, Maine, San Antonio, Texas, Atlanta, Georgia, and Hennepin County, Minnesota, where we identified community partners. Actually, Phil led a few of these community listening sessions, where we really sat with community and thought about what were the things that needed to be within this action guide to really move the needle and to support local leaders in creating social connection plans. The next step in this process was actually having Dr. Julianne Holt-Lumstad and a team of her graduate students. She's actually the scientific expert that the Dr. Vivek Murthy used within the advisory on social connection. So she and her students actually did the coding of a lot of the data that came out of the community listening sessions. The other parts of this I won't read and kind of go into, but we definitely take a community-centered approach, really thinking about stakeholders and local leaders. And then in September of 2023, we launched the action guide and have just had an incredible reception to it. Okay, so that was the how and the why, and now I'll get into the what. Next slide, please. So the action guide is separated into 6 distinct steps. Phil, thank you so much for dropping the action guide link in the chat. But the first 3 steps are really kind of focused on learning and preparing. So step 1 is a reflection exercise. The second step is a lot of information on social connection, the background, the definitions, some of the stuff that I covered today, but it goes very in depth. The third step is a community social connection assessment. There's 3 components of this. The first is a data dashboard, which I'll make sure to share with Megan and Karan, but that's at a county level. So we pulled in 15 indicators that I think I don't know if this is known in this group, but there is not a social connection measurement or index. So what we did is we took 15 common indicators across the country, including transportation, the number of libraries in a community, and really kind of put that all on one data dashboard so that you can go in and type in your county and look at how your county stacks up to the state as well as the nation across these 15 indicators. The second component of that is a partnership mapping exercise where you as an organization or you as a leader actually start to think about who are your partners in this work, what is their level of influence, what sector do they represent. The third component is a really kind of toolkit on how to conduct a community listening session, which we think of also as a really rich data point, where you're looking at the assets in your community, the challenges, the populations that are experiencing this, and starting to think about what might we do. Steps 4 and 5 are really oriented towards planning and implementing. So step 4, which I think is kind of not to choose a favorite, but probably the most important part of the action guide is conducting a social connection workshop where you're bringing all of your partners together and you're starting to think about and actually get to like the nuts and bolts of a plan. What is the target population that you want to work with first? What might you do? And then step 5 is about tracking and measuring. So we believe that everything is iterative, and it's really important, like even though you get a plan off the ground, an initiative off the ground, you really want to think through how are we measuring success of this program. And then step 6 is about evaluating and sharing out. So as kind of a research-backed organization, evidence is really important to us, and we wanted to make sure that the tools and resources for communities were there and ready for them to really evaluate and then to share out. And as Phil said, one of the best parts of our work is actually lifting up promising strategies. So there's a page on the action guide that's actually dedicated to promising strategies that we've come across as we've done this work across the country. We have 21 right now. That's steadily growing, and we're really excited to continue that work. Next slide, please. Phil, I think this is where you take over.
Yes. Thank you, Morgan. So she could only give you essentially a thumbnail of the action guide. You'll have click into the link. Maybe you have as she was talking, but it's a beautifully done multi-step interactive website. So we're so used to getting the PDF report. Maybe we send it to the printer, maybe we don't. But this is one where you can actually pull into step right into the different phases of it, type in who your partners are. You can look at the data. There's also a really valuable data dashboard in there. So check it out, play with it. Maybe it'll give you some ideas of who you might work with in your community or organization to start collectively thinking about an intentional approach around social connection. So these right here are our suggestions for further reading. There are volumes and volumes of things you could read. In fact, if you have something that you would recommend that we and others look at, go ahead and put them in the chat. I'm gonna enter all of this right now, just so you have it in your chat. I encourage you to save it somewhere so you can follow them up later. The Surgeon General's advisory is here that we talked about earlier. The action guide, beautifully done by the Foundation for Social Connection and others. Morgan's team also created this is a brand new document, the one that says social in all caps, the social framework in the built environment sector. That really focuses and aligns with the conversation we had about social infrastructure. So what's happening in public spaces. And then one that I included is a report that helped us. Our first big step around socially connected communities is a report we did in 2021. We actually had started doing it, a project Robert Wood Johnson and communities across the country around social connection, where we we developed this document and COVID hit. It just coincided with this report. And you can find it at a landing page. So that link right there that I put in the chat, we have a landing page of all kinds of things, one-stop shop for around socially connected communities. That report is there. There's a learning network that we have that we support. There are examples and other things that you might be interested in. And it looks like, yeah, please send other commit to connect. Thank you, Megan, for suggesting that one. I think we can go to the next slide, and we have a little bit of time for discussion. Maybe we just start with what you were thinking when Morgan was talking about the action guide. Could you see using it? Maybe you've seen it already, and you've just heard Morgan talk about it, but maybe you already got some of our notices in your inbox and you clicked through it. Have you used it, or someone maybe sent it to you? So just unmute if you have any comments in particular about the action guide, or maybe a light turned on, you could see a way you might use it. So we'll just pause here and see if anyone wants to jump in about the action guide. And Morgan, feel free if you have anything else to say about how folks might apply it.
We know this group isn't shy, so.
I see Donna. Donna's unmuted. Go, Donna.
No, I actually went on while you were talking. I went on the dashboard, and I live in a very interesting county in that, one half is very affluent. It's, Jackie O country. And then the other half is more ethnically diverse and more middle class and lower middle class. And so when looking at that, it kind of gives you a whole, the whole county. But have you done anything at the municipality level? Because I'd love to see what those same stats that I just looked at for my county will look at my zip code level. Is that something that's possible or in the works?
Yes, it is. Right now we have it, like you said, at county level. We're getting there. We're hoping that in our next iteration of the data dashboard that we'll be able to do either if you want to do a collection of census tracts, municipality, but like different ways of looking at it. But right now we're at the county level, but it's definitely something that's in the kind of cooker.
Okay. And I just posted in the chat before about isolated seniors. So they use the definition of isolated seniors as someone who lives alone, but that doesn't necessarily mean they're isolated, because they might live alone in a congregate housing, or they might have the county bus takes them to the senior center, or they may drive. So how accurate is that number of isolated seniors? Because that's something that we were just talking about earlier part of the presentation, and that's something that we're looking to address as a community as well. Yeah.
Donna, I love the points that you're bringing up, and these are conversations that we also are having. So the data dashboard, I said, is about indicators, and I use that word very intentionally because it is one aspect or view of the situation. And so I think as human beings, we have a reliance on data, the numbers per se. But what you're pointing to is that there's actually, and I put my kind of a question back to you, is does that actually feel like that represents what's happening in your county? And you're telling me, no, it isn't. So that's why there's the three components of step 3 that are different ways of thinking about data. And that community listening session is really important piece, because that brings in the lived experience. So that's kind of what I would put back to you. So we're not necessarily saying that those seniors that are living alone are experiencing loneliness or are representative of isolation, but we are kind of it's the best data that we have at this point, because it's from census data.
Okay. Yeah, no, I was just, I guess the term would be more like living alone.
Yeah,
So as opposed to isolation, because I don't think living alone necessarily is the same thing as being isolated. I
Yeah.
think there's a distinction there.
yeah, your point is well taken. Thank you so much.
Yeah, and living, as I think, as Morgan said, living alone and isn't necessarily mean lonely. And then I want to say thank you, Cynthia, for putting this Friendship in the Age of Loneliness, Optimist Guide to Connection. Thank you for putting that into the chat, another resource. A point I would underscore is that what Morgan has shown in the last few slides is a comprehensive process guide. One part of it is the data dashboard, which is, I don't know, the sexy part that, a lot of people, especially data people, go to it because you can select your area and almost stay there and, play with it. But that is but one tool, automated tool or interactive tool to help you understand what's going on. And as you know, it will take conversations and being in the space with others in the community who are experiencing isolation to fully understand the picture. So that's just, as Morgan was saying, that's just one point to help you understand the situation in your community. So are there coalitions in your communities that are looking into social isolation and social connection? I'd love to know if you have one. You could put them in the chat, or you could come off mute and tell us just briefly whether you have a socially connected community coalition or task force. We certainly are interested in learning more about where they exist. Or maybe there's a collective impact that's focusing on mental health, and you happen to have a subcommittee on social isolation and connection. Well, please do let us know if you learn of one, or you could tell us after the fact. There's one more question. Maybe we could do this if you'd like to unmute and tell us, or just go ahead and put them in the chat. So we often do this as an icebreaker, or if we had an opportunity to put you in breakout rooms, we actually provide this question. So what are the assets in your community that support social connection? And this is one of the questions we use when we do community listening sessions. So if you were to go to the action guide, you'll see this question in there. What are the things that are in place right now that are connecting people? Frank, Atlanta Regional Commission. Thank you. So an organization. Frank, do you mind unmuting and saying a word about that? Is that a group that is intentionally taking on social connection, or do you see them as a more generally supporting social connection?
Just a second. Can you hear me okay?
Yes.
Let me pause something. I'm working on multiple things at the same time. It's a busy day.
Vice President for Health Innovation and Strategy, and the Principal Investigator and Director for the Innovation.
I see that Lou's Age Strong Commission in Boston. Thank you for that idea. They are actually part of the partnership that's supporting the projects for Activating Boston, and they made, as you may know, they actually made grants to community-based organizations that were serving older adults within neighborhoods to focus on social connection. The public library, Warford Community Center, great. Well, Frank, I'm sorry we missed you, but We appreciate the time that you've given to us today, listening to Morgan and I, and all that's in the chat. I'm gonna make sure I save the chat so I can see all that was said that I missed. I appreciate all of the reading, the extra reading and examples, and thank you those who shared your email for follow-up. Before
So
we,
if I
yes,
could
go
just
ahead,
say a
Meg.
word here too, as part, and I think Frank just came back in, so he might still be able to share with us. But I just wanted to mention, because it's come up, it came up a couple of times, is for the public health audiences and for those of you who represent a public health organization or a public health department, using the community health assessment process, I think could be really important in this work, and in a couple of ways. One is in conducting focus groups for that community health assessment process. And the National Association for County and City Health Officials, NACCHO, has a number of resources that can help you all in doing that assessment, and including older people as well in those focus groups. Because as they talk about being lonely or being isolated, that's when those that data can begin to be collected, and interventions can be designed and included in your community health improvement plans. So so it's the data piece, it's the focus group, and then it's elevating social connection as a priority.
Yeah,
So
thank you,
it
Megan. It's like remembering what public health, like what are our skills, what do we bring to it, and how can that bridge with other organizations. Frank, are you able to just say a word about the Atlanta Regional Commission?
Yes, can you hear me okay?
Yes.
Okay, so I'm Frank Sutton. I work with the Morehouse School of Medicine, and we have a with the older adult community in Fayetteville County, Clark County, and then also Fulton County. And we partner with the Atlanta Regional Commission to help deliver some of our what we call empowerment series. So we actually were putting on the activities for the older adults to have social connection outings.
Great, thank you.
Thank you.
Glad you could join us today.
Thank you.
I think we're probably almost at time, Megan, and
we are, yeah, we've got just a couple
appreciate
more
you.
slides to cover, but thank you all so much. This was so informative and so helpful. We love being able to provide tools for this audience. And although we had a number of people who were not able to actually join, everybody who registered for the session today will get all the resources and the recording, a link to the recording as well. So we're sure that will be shared out. I'm going to turn the presentation, the end here, back over to Karan, who will close us out.
Thank you, Megan, and thank you so much to our presenters, Morgan and Phil. I certainly appreciate all of the rich context you shared today. And as you can see, our group is not shy, so I am also going to make sure we capture the links in the chat, and that also will be shared out with our recording. So just a reminder for our upcoming training in June. Will be on June 20th at 3 p.m. You can register for this under events. Just to give you a little teaser, the training will focus on NACCHO Public Health Systems brief on the 10 essential public health services and how that connects with our NACCHO Public Health Systems 60s framework. So look forward to that next month. And finally, if you are in the progress of becoming an NACCHO Public Health System champion, please get the QR code and record your attendance at this training. And if you are viewing this as a recording, please pause now to note that you have attended this training so that we can get you counted towards your 6 to become a champion.
And Karan told me that she just recognized 6 more champions today. So we're very excited. Thank you all very much.
And with that, we'll close us out. Thank you all for attending today.
Thanks, everyone. Thank you, Phil.
Thank you. Bye.
Thank you, Morgan. Really appreciate it.
Great to see everyone. Thank you.